Phoebe primary care physician Dr. Derek Hurd is here with us today to talk about minority health. Now, the theme for National Minority Health Month in 2023 is better health through better understanding. What does that mean to you?
Well, Ben, there's an old saying that if you know better, you do better. And so health literacy is one of the things that we're really going to be focusing on. And that's getting people to understand what their diseases are, what disease they may be at risk for, and then how to actually deal with those things. Because if you know what disease you have, if you know how to treat it, then you can actually be empowered to actually help keep yourself healthy.
People may not realize Georgia actually has the second highest African American population in the country. So this really is an especially important topic for us here, isn't it?
Yes, not only does Georgia have the second highest minority population in the country, in Albany we are a minority-majority population. And so in that regard, as primary care physicians, we have to make sure that we are educated about the diseases that can affect the African American population.
What about those diseases? What kinds of illnesses are we talking about that are more prevalent in minority populations?
Well, Ben, we all know that hypertension is a scourge in our society. We know that diabetes is definitely an issue that we have to be worried about. African Americans are like 1.6 times higher, have a higher likelihood of developing diabetes than white Americans, and they're 2 times more likely to die from complications of diabetes. We also know that there are certain cancers that African Americans are more likely to develop and die from. So we have to make sure that we're educating everyone about those diseases.
So why is it? Why are minority groups, is it more likely for certain minority groups to get these illnesses?
Well, Ben, that goes back to the health literacy that we were talking about. If you're not aware that you have these illnesses because you're not going to the physician on a regular basis, if you don't have the income to make sure that you can go to the doctor to pay the copay, to buy the medications, if you don't have access to healthy foods, if you don't have access to safe places to exercise, if you don't have access to transportation to get where you need to get. These are all things that are generating issues with health disparities. And so we're having to make sure that we start addressing those things in this community. And again, it's about knowing that you're at risk for this so that you can then help yourself as well.
Yeah, what can we do about it? How can we make sure to try to address these problems so that minorities aren't more likely to die from some of these diseases?
Well, the first thing that we need to make sure that we're doing is getting hooked up with a primary care provider. Again, at Phoebe, we have a number of different clinics here in the area that you can become a part of. And getting access to that is fairly simple. 312-MyMD is the number that you can call to make sure that you can get an appointment with a primary care provider. But then once you've had access to that provider, it's asking those questions. Am I at risk for cancer because of my family history or because of things that I may have been exposed to? Am I at risk for obesity? Do I have high blood pressure? If I have high blood pressure, does that put me at risk of developing chronic kidney disease? Am I at risk for developing diabetes? It's having that conversation with your primary care provider that will then give you the answers that you need to then move forward. And your primary care provider can also at that point talk to you about things that you can start doing, whether that's changing your diet, trying to eat better, making sure that you have access to certain types of foods. It's the yearly screening, wellness screenings that you can be doing. All those things are important and can help the minority populations get back to a healthier state of living.
What are some specific things that Phoebe is doing to try to bridge those health disparity gaps and address health inequities in the community?
Well, at Phoebe, we have made it our mission to improve health equity in our area. So we're partnering with lots of different local organizations to make those things happen. We have a partnership with Horizons Community Solutions to provide access to colon cancer screening for those who are uninsured or low insured. We've developed a partnership with Morehouse School of Medicine where we have something called the Elevation Project that's going out and teaching community members about prostate cancer screening. And we're also going to now be working on breast cancer screening, cervical cancer screening. We have developed a program for patients who have elevated A1Cs who are uninsured, and we're going to be providing fresh fruits and vegetables for them. to see if that can improve their A1Cs and help them lose weight. We're also working on a project in East Albany in conjunction with Albany Area Primary Health Care, where we're going to be targeting patients who have certain diseases such as COPD, CHF, and diabetes, and providing more targeted care coordination to see if we can reduce the likelihood of them being admitted to the hospital. So Phoebe is putting its money where its mouth is, and we're making sure that we give access to African Americans and to other minority groups that are truly at high risk for diseases.
Well, I know health equity is a topic that's important to you, and I appreciate you spending some time talking with us about it today.
Thanks, Ben.